Bulimic victims have special dental needs. Too often, the dentist is confronted with teeth that have been stripped of their protective enamel coating. This stripping exposes the soft material under the enamel to the stomach acids and jeopardizes both the health and the appearance of the bulimia victim. I'm Tanya Goodman for Advanced Cosmetic and Laser Dentistry. I recently sat down with active bulimia patient Aimee Fitzgerald. Aimee shared her story with me as she prepared for new porcelain veneers from Dr. Brian McKay.
I'm ready for this. I'm ready. I'm not lying about this anymore. This is a time that I can go forward feeling really confident that this is something I've gotten through, that I can actually say that I've beat it. It's been a long journey. I'm 34 years old now, and my bulimia started when I was 16 years old. It started almost by accident. I was a competitive swimmer, and I had a big swim meet, a big swim invitational, and I'd eaten too much at lunchtime when we had taken a break for lunch. Had come back, and I had to swim backstroke immediately after the lunch. Went to the bathroom, and literally it was something that was really easy for me. I learned that I could basically throw up by bending over. I quickly also learned at a ripe age that it was important to be pretty. I got a lot of attention for being pretty. I was a homecoming queen, and it was a small school, but still I got a lot of attention for being, for looking a certain way. And so I got messages that said, that conflicted with the fact that I learned to eat, and eat a lot, and eat to deal with emotions. So I was I was addicted to the high of doing well at things and being very perfectionistic about school, about my sports. So the bottom line is, anytime I didn't do well enough in things, I ate and learned that I could throw up and still be pretty, and always had that concern with the perfectionism. So you can see how it just started spiraling into the bulimia, and this was such an easy alternative. I learned that I could, unfortunately, that I could eat over my emotions, and I could still be what I considered to be pretty, or still be able to maintain a certain weight. I hid it. It was always very, very shameful to me. It was something that I was doing that was like a cop-out. And it was something that I never wanted anyone to know about. I had a high school boyfriend that I went on to date for 6 years, and he never knew about it. In fact, no one knew. My family didn't know. I hid it, and you become really good at hiding it. And I became more and more ashamed of it. And then the emotions of the shame would perpetuate the eating again. And so it was this horrible cycle. And I was still determined, day after day after day, I was determined to beat it on my own. And it just beat me down. And it was one thing in my life that I really failed at day after day after day. So the shame grew, the eating disorder grew. It came to a point in college where I was binging and purging, 3 or 4 times a day, and yet still working out compulsively to maintain, because then it just became this really vicious cycle where I needed to maintain. It felt like all I had was to maintain my looks. I think then I finally got to a point where I couldn't live the 2 lives anymore. I had 2 lives that were just, one was on the outside I was this facade of, people would always say, how do you do it? You look so good, you're so pretty, your smile's so nice. How do you, keep your grades are good, you have it all, and people would say that, and inside I would be thinking, if you only knew how disgusting I am, what a monster I am, the things that I do, that I will, pick food out of a trash can to make sure that I can get whatever I need. If I've binged and purged and yet there was some food from a roommate left in the trash can, I would pick it out of the trash can and eat it because I knew I was just gonna throw it up. And you do things like that, and you just learn to be disgusted with yourself. I finally came out and told my parents that it was killing me living these 2 lives. And I didn't want any help from them. I told them this is something that I needed to do. I needed to go into some sort of treatment program. My mom has really become my best friend going through this. Since the second treatment program going forward, my mom just learned to really know that I was struggling and that I wasn't getting through it, even when I said I was. There wasn't a lot of treatment options at the time. I found an outpatient program in Boulder, Colorado, where I'm from. I guess I wasn't ready for it. I think I was still dealing with my shame and needed to deal with my shame about it first because I needed to get through that. The bulimia is a symptom of a deeper issue, and the deeper issue for me was dealing with my anxiety and dealing with the fact that I dealt with my emotions in an unhealthy way as opposed to just feeling anxiety or feeling sadness or feeling anger. And instead, I numbed myself by eating, and I learned to do that at that very young age, that this worked, and it works effectively. I literally felt like I needed to be locked up at a certain point, and that was the beginning of the healing process. But then a second treatment program, a thorough, intensive treatment program, a 3.5-month treatment program that really was the turning point, the ultimate turning point for me, where I really started dealing with my shame and started having success with my bulimia. It's not about willpower. It really isn't. It's about making a choice that you want to be well, but it's not about willpower. It's really understanding what it is, and if you don't have the education, the understanding about it, you can't get well. You really have to understand what the underlying issues are, and it takes you really taking a look at yourself. Learning to live a life that's different today, learning to deal with my anxiety in different ways, learning to deal with my emotions in different ways, having gone through that for several years, living back out there and having success doing it and living my life again. My smile reminds me of all the years of my eating disorder, and it's symbolic of all of the disappointment and all of the shame. And so I look at my teeth and I think about my smile and the damage that I've done, and it's just symbolic of all of those years of what I did. I think that's what this smile symbolizes, is the difference in my life today. Yeah, it's a huge milestone because my teeth are the one piece of me that really is still a part of that. It's still, I look back at those pictures and I was smiling and beautiful, but yet I know at certain times in my life that I wasn't. The way I felt didn't mirror image the way that I looked. And my teeth today, I think, still represent that part of my life. For me, the symbolism of making the changes in my life and feeling good about that and having self-esteem about the things that I've done to make the changes, that's what it represents to me. And it's a tremendous success to be here and be able to look at myself every day and say, you've done it, you've come this far.
Unfortunately, Aimee has lost most of the enamel from her teeth due to binging and purging since she was a teenager. Aimee and Dr. McKay have prepared for this moment. And when she is done, she will have a new smile, along with the added confidence and improved self-esteem porcelain veneers offer for bulimic patients. The procedure is over, and now Aimee, along with Dr. McKay and myself, are admiring her new smile. We hope Aimee's recovery continues.